Hi, it's Dr. Davidson of Revolution Aesthetics. And today what we're going to do, we're going to talk about the coronavirus, its effects on the clinic, and then use some science behind it to glean some ideas of what's going on at the moment, and then make a few predictions about what we can do in the future and how to stay safe. So why did we close early? We still have some people questioning why we couldn't continue. We're well known to be a very clean and safety conscious clinic anyway. So if we reduce the number of people, why can't we still see you in clinic? The reason we closed early and tied up all our reviews a little earlier and closed earlier before government guidance is because Rebecca works in dental practice, I work as a GP, and I also work in an A&E setting. So we had a bit of inside knowledge to know that this is probably where this outbreak would take us. And ultimately it just wasn't worth it. You know, aesthetic medicine's great, the clinic is awesome, and we love all of our patients, but this can definitely wait until we're on the other side of it. There's loads of stuff that we're going to give you tips to help skin care, stay healthy at home anyway, so don't worry, we've got you covered. But let's look at the science of it. This idea called viral load, I mean, we know what coronavirus is now, we know the term COVID-19, we know of its relationships to flus and other pandemics such as SARS. But the idea of the viral load is what's led us to self-isolation and quarantining now. So if one person coughs on you, transmits to, many mucous membranes, eyes, nose, mouth, what happens is you may get the symptoms, but what we're hoping is, particularly if you're relatively healthy and have no other significant past medical history, that you'll get it like a cough and cold. You'll get the symptoms, you'll get over it, you finish your quarantine. Okay, obviously now we're self-isolating and not doing as much, and the places in lockdown, you're not going back to work, but the idea is to get over your symptoms, stay away, stay indoors, and hopefully you come in and out of it with no concerns. If you increase the number of people with the virus coughing on you, particularly in a short period of time, you increase that exposure, you increase that viral load. And what ends up happening is your symptoms become or can become unpredictably high-precedented. You might not be able to tolerate the symptoms that you uncover. That's where you then need potential oxygen support. You might need respirator support. We don't know how you will react if you're exposed to a large degree. But we do know now it's affecting younger people. We do know now it's affecting those without significant past medical history concerns. So the safest thing to do is to stay indoors, stay away, and reduce the spread. That sombrero hat, essentially what it means is reduce the peak of cases out at any one time. This brings us to our second scientific idea of herd immunity. So sometimes we have an idea of we can give loads of people the vaccine, so there's less of the illness or infection or disease out in the community, so we stay safer as a nation, so to speak, as a community of people that's all had the vaccine successfully. However, we don't have a vaccine. Testing is going to increase, the vaccine testing is going to increase, our own COVID testing will increase, and swabbing will increase over days to weeks. So that will come and that will improve over time. But for now, because we don't have access to this, the idea of this herding has got to be just keep the virus out of the community the best you can. So if we all stay away, particularly if we do have it, we stay away and we can stop the spread to those people that can't fight off this illness. So it's not like we're all taking a vaccine and then if everyone gets it, it'll be great. We don't want that exposure to be high anyway. And we want the people to catch it to a lesser degree. We don't want them to have the really horrible symptoms that we're all scared about and it's all over the media. So that's what we're trying to prevent. So stay indoors, learn from this. Another thing to look at in the nature of viruses and the nature of illnesses, infections, epidemics, we don't know if there'll be a second spike. We don't know if there'll be a seasonal spike when the weather changes and the seasons changes, particularly in other parts of the world. So this is something we need to prepare for. We learn from this. We stay indoors, we wash our hands, we reduce exposure, we take care when we're coughing and sneezing outside. And that's what we need to do moving forward. We're a nation of hand washers, we're a nation of runners, we're keeping fit, we're looking towards good hygiene. This is what needs to happen moving forward. particularly as we move on to later in the year, to prevent or to at least be prepared if something else reoccurs. Interesting information that's come through for the course of the week. We now know that pregnant ladies can be affected, their offspring can be affected, so we need to be more mindful, be careful. Please, in the same respect, if you have it and you're better and you've built up immunity, those type of positive immunity products should also pass on to your child, so that's great. But additionally, children, I think we might have been a bit lax early on, some people, about thinking that your children can't get it. They can. We worry about them too. So protect them as you would protect yourself. Teach them the good things about good hygiene. Right now, it's great to learn while you're young. So hopefully, I've been able to give you a little bit more insight into what's going on, a little insight into the nature of staying indoors and quarantining. Remember, 7 days at least. 14 if you're exposed to no symptoms, another 7 from the time you get those symptoms. Loads of tables out there and information out there, but what we want to try and do is spread positive messages and like really positive media out there, and avoid the fear and some of the horrible tactics that are used to get views. So make sure we're sending really good positive messages out there into each other, and most importantly, remember to stay safe. Any questions or queries, we will try and manage, and as information comes in, we'll try and do more videos like this to inform you. And just look after yourselves and everyone else. Community support needs to come out of this as well. Look after each other. All the best.